Picture this. It's the end of the day, you kick off your shoes, and instead of relief, you're staring at feet that look and feel like they belong to someone else. Puffy, heavy, almost like balloons. And you think to yourself, well, I guess this is just part of getting older. But let me tell you something, as a physician who spent more than 30 years caring for people over 50, that belief is flat out wrong. Swollen feet may be common, but they are not inevitable. And the truth is, there are simple, natural steps you can take to feel lighter, walk easier, and finally get that comfort back, without expensive pills or complicated treatments. In today's episode of Senior Health After 50, we're going to dive into the real reasons your feet swell as you age, the overlooked risk factors you need to know, the home remedies that actually work, and yes, even a 5-minute daily routine that could change how your feet feel in just 1 week. And before we begin, if you find this kind of practical, science-backed advice helpful, I'd be so grateful if you take a moment to like this video, share it with a friend who might be struggling, and subscribe to our channel. That simple action helps us reach more seniors who deserve to live healthier, more comfortable lives. Now, let's get started, because relief may be a lot closer than you think. Why swelling happens. Deeper medical insight. When we talk about swollen feet, what we call edema, we're really talking about how your circulation system starts to change with age. Think of your blood vessels as highways. One lane brings blood down to your feet, the other carries it back up toward your heart. When you're young, traffic flows smoothly in both directions. But as the years go by, that return lane can start to clog up. Veins weaken, the tiny valves inside them don't close as tightly, and the muscles that usually help pump blood upward aren't as strong. Add in slower kidney function or even small changes in the heart's pumping power, and suddenly fluid has nowhere to go but downward, pooling around your ankles like rain collecting in a ditch. But circulation alone doesn't tell the whole story. Diet plays a starring role, especially salt. Too much sodium acts like a magnet for water, dragging it into your tissues and making swelling worse. This is something I once explained to a patient who laughed and said, "So doc, my ankles are basically sponges?" And the truth is, yes, in a way. We've even seen this play out among world leaders. Take Winston Churchill, for example. The man who guided Britain through World War II loved his rich, salty meals and often joked about his nightly indulgences. But in his later years, he struggled with fluid retention and swollen legs, classic signs of the circulatory strain that comes with age and diet combined. And then there's medication. Some of the very drugs designed to keep blood pressure or inflammation under control, like calcium channel blockers or long-term steroids, can actually make your body hold on to extra fluid. Former President George Bush, for instance, once dealt with medication-related swelling that made walking painful during parts of his recovery. The irony is that the pill helping one problem can quietly be feeding another. And here's the part that surprises many. Not all swelling is about fluid balance. Inflammation is another culprit. Conditions like arthritis, gout, or autoimmune disorders can trigger swelling that looks similar but comes from a different mechanism altogether. Immune cells rushing to a joint, releasing chemicals that draw fluid in. Franklin D. Roosevelt, who famously battled polio, also endured years of inflammatory joint pain that worsened swelling in his legs. His story reminds us that sometimes the swelling isn't just about circulation, it's about inflammation running wild. So the real key here isn't simply saying, "I need to get rid of this swelling." The smarter approach is asking, what's causing it in me? Is it weaker veins, too much salt, side effects from a medication, or inflammation from arthritis? Each cause has its own roadmap to relief, and once you know which road you're on, you can finally steer toward lasting comfort instead of just temporary fixes. Who's at risk? Now, let's talk about who is most likely to deal with swollen feet. The truth is, this isn't a condition that picks its victims at random. There are clear risk factors that stack the odds against certain people, many of them within our control. First, extra body weight. Carrying even an additional 20 or 30 pounds means your veins are under constant pressure, like a riverbank trying to hold back rising floodwaters. Over time, that strain weakens the valves inside your veins, and fluid begins to pool in the lower legs. I once told a patient, "Your legs aren't angry at you, they're just overworked," and that stuck with him. Second, limited mobility. If you sit for long hours, whether at a desk, in a car, or even in a favorite armchair, you're at risk. The calf muscles, sometimes called the second heart, play a crucial role in pumping blood back up toward the chest. But if you're not moving, those muscles are silent and fluid stagnates. Third, chronic conditions like diabetes or heart disease. These don't just affect blood sugar or heartbeat, they impact the integrity of your blood vessels. When vessels stiffen or circulation slows, swelling becomes inevitable. And let's not forget medications. Calcium channel blockers, used by millions to control blood pressure, are notorious for causing leg swelling. Steroids, too, can make the body cling to fluid. A well-known case is that of former U.S. Secretary of State Madeleine Albright. She openly discussed how some of her prescribed treatments left her dealing with puffiness and swelling, side effects she had to balance against the benefits of the medications. Finally, there's varicose veins. These bulging, rope-like veins are more than a cosmetic nuisance. They're a direct sign that blood is struggling to move upward. Many celebrities, including talk show host Oprah Winfrey, have spoken publicly about their battles with varicose veins. Oprah herself joked about wearing compression stockings on long flights after realizing how much her legs would swell during travel. The bottom line, whether you're a head of state, a queen, or simply a grandparent chasing after the kids, the risk factors for swollen feet don't discriminate. But recognizing them is the first step toward taking control. Practical remedies, turning science into relief. So now that we've identified why swelling happens and who is at risk, let's get practical. What can you actually do about it, right now, at home, without waiting months for a doctor's appointment? The good news is, you don't need an expensive machine or a miracle pill. Relief often comes from simple, science-backed habits that you can practice every single day. 1. Elevation. Gravity on your side. Sometimes the best medicine isn't medicine at all, it's gravity. By raising your feet above the level of your heart for 15 to 20 minutes, a couple of times a day, you're literally giving your veins a chance to drain. I often tell my patients, your legs deserve a coffee break just like you do. 2. Epsom salt foot soak. Old remedy, new science. This is one of those timeless solutions that actually holds up under medical scrutiny. Magnesium sulfate, the key ingredient in Epsom salt, relaxes muscles, dilates blood vessels, and eases fluid movement. Many seniors describe it as a spa moment for their tired feet. 3. Hydration, fighting fire with water. This one always surprises people. Doctor, if my feet are swollen with fluid, why on earth should I drink more water? The answer? Because dehydration makes your body panic. When you're short on fluids, your body holds on to every drop like a survival strategy. Staying hydrated helps flush out sodium, which is the true culprit behind fluid retention. Look at athletes like Serena Williams. Even in retirement, she emphasizes hydration as one of her cornerstones for muscle recovery and circulation. And if it's crucial for a world-class athlete, it's even more critical for seniors whose circulation naturally slows with age. 4. Salt reduction, the silent sweller. Americans consume nearly twice the recommended daily sodium, often without realizing it. Hidden salt lurks in canned soups, deli meats, and even bread. Too much salt acts like a magnet, pulling water into your tissues. Herbs, spices, and citrus zest can be powerful replacements. Not only do they protect your arteries, but they also give your meals richness without the bloat. 5. Compression socks, the hug your legs need. Think of these as supportive assistance for your veins. Compression socks gently squeeze your legs, encouraging blood to flow upward and preventing fluid from pooling at the ankles. They may feel unusual at first, but many describe them as a reassuring hug for their calves. So whether it's elevating your legs while watching television, soaking your feet in Epsom salt before bed, drinking an extra glass of water, cutting back on sodium, or slipping on compression socks during a flight, each of these simple remedies adds up. I often remind my patients, swelling may feel like your body is betraying you, but in reality, it's a signal. And if you listen to that signal with practical steps, you can bring relief, regain comfort, and avoid more serious complications down the road. Best exercises to reduce swelling, movement as medicine. When it comes to swollen feet, I can prescribe medications, recommend stockings, or suggest diet changes, but nothing matches the natural power of movement. Why? Because your muscles aren't just for walking or climbing stairs, they're pumps, especially your calves. Every time those muscles contract, they squeeze the veins and lymph vessels, pushing fluid upward and keeping circulation alive. Let's walk through the best, safest exercises seniors can do at home. No gym, no fancy equipment, just your body and a little consistency. 1. Ankle pumps, the gas pedal exercise. Sit back in your chair or lie on your bed. Point your toes up toward your head, then slowly press them down like you're pushing on a car's gas pedal. Back and forth, steady and smooth. This motion stimulates blood flow in your lower legs, almost like squeezing a water balloon upward. Do it for 20 reps or about 30 seconds, and you'll feel the difference. 2. Toe flex and spread. Wake up the small muscles. While sitting, curl your toes tightly under, then stretch them wide apart. Repeat this 10 to 15 times. These small muscles play a huge role in helping lymphatic fluid drain. Eleanor Roosevelt, a woman known for walking the halls of the White House and tirelessly traveling as a diplomat, often did simple foot stretches at her desk. Letters from her secretaries mention her rolling her toes during long meetings, an understated but effective way of keeping swelling under control. 3. Seated marches. March without leaving the chair. Sit tall in a sturdy chair. Slowly lift one knee, then the other, as if you're marching in place. Aim for 20 reps total. I recall Pope Francis, who has struggled with knee issues, being encouraged by his medical team to keep circulation alive with seated movements during long audiences and flights. Even when mobility is limited, the act of gently lifting the legs can spark blood flow and reduce pooling in the feet. 4. Calf raises, the second heart workout. Stand behind a chair for balance. Rise up onto the balls of your feet, then lower slowly. Repeat 10 to 15 times. Your calves are nicknamed the second heart for a reason. They're circulation engines. 5. Foot circles. Oil the hinges. Lift one foot a few inches off the ground. Rotate your ankles slowly 10 times clockwise, then 10 counterclockwise. Switch sides. This loosens the ankle joint, improves mobility, and encourages venous return. Imagine Nelson Mandela during his years of confinement. His doctors encouraged simple ankle circles in his cell as a way to keep circulation alive, even in the most restricted circumstances. Small movements, but deeply powerful. When my patients ask, "Doctor, do these tiny movements really matter?" I remind them of this. It's not about one exercise, it's about consistency. Do a little every day and the results add up. Swelling lessens, shoes fit more comfortably, and walking feels lighter. Think of it like brushing your teeth. One brush won't prevent cavities, but brushing every day changes your future. These exercises are the same. They're brushing for your circulation. The 5-minute daily routine. Small steps, big relief. Here's the part my patients love the most. A simple 5-minute routine that doesn't require a gym, special gear, or even leaving your living room. It's designed to fit into your day like brushing your teeth or making your morning coffee. Do this daily, and within a week, many people notice their shoes fitting better, their steps feeling lighter, and their evenings less painful. Morning. Jumpstart the circulation. Right after you get out of bed, before the day's gravity and long hours on your feet take over, do a quick set of ankle pumps and calf raises. Think of it as priming the engine. Afternoon. Midday reset. Sometime after lunch, take a 10-minute walk. Nothing fancy, around your garden, down the hallway, or even in circles through your living room. Then finish with some foot circles while seated. Evening, relax and restore. In the evening, soak your feet in a warm Epsom salt bath. This not only helps swelling, but also signals to your nervous system that it's time to wind down. Afterward, elevate your feet while watching television, reading, or chatting with family. This routine covers the 3 pillars of circulation: activation, hydration, and rest. Morning activation wakes your muscles. Afternoon walking pushes blood through your system. Evening soaking and elevation let gravity and relaxation finish the job. I tell my patients, think of this as sending your legs to the spa 3 times a day. Except you don't need to pay a dime. It's all in your control. When to see a doctor, knowing the red flags. Now, let me be very clear. While most swelling in the feet is harmless and manageable with lifestyle changes, there are times when swollen feet are not just a nuisance, they're a red flag, and ignoring them can have serious consequences. Here's when you absolutely need to seek medical help. 1. Sudden swelling in one leg. If one foot or leg balloons quickly while the other looks normal, that could signal a blood clot, what we call deep vein thrombosis, DVT. This is dangerous because a clot can break loose and travel to your lungs, causing a pulmonary embolism. 2. Swelling with redness, warmth, or pain. If the area is tender, red, or feels hot, it could mean infection or inflammation. This is particularly urgent for people with diabetes because their immune systems may not fight infections as well. 3. Swelling with shortness of breath or chest pain. This combination could point to heart failure, kidney trouble, or a dangerous clot in the lungs. Don't wait, call a doctor immediately. 4. Persistent or worsening swelling despite home remedies. If you've been elevating, moving, hydrating, and cutting back on salt but the swelling continues, it may be time to check for underlying conditions like kidney disease, venous insufficiency, or medication side effects. Swollen feet don't always spell disaster, but sometimes they whisper secrets about your heart, kidneys, or circulation. If you notice sudden, one-sided swelling, redness, pain, or swelling combined with breathing problems, don't brush it off. Those are signals your body is begging you to pay attention to. I often tell my patients, your feet are messengers. If they're shouting, listen before it's too late. Swollen feet may be common, but they don't have to be your normal. Yes, swollen feet are common after 60, but common doesn't mean inevitable. You are not sentenced to live with heavy, puffy ankles just because you've crossed a certain birthday. I've seen patients in their 70s, 80s, even 90s who decided they wouldn't accept swelling as just aging, and their results were remarkable. Take former US First Lady Michelle Obama. Even while traveling on long international flights, a situation notorious for causing swelling, she made movement, hydration, and stretching non-negotiable. She has openly shared how important daily routines are to her health, especially after 50. Her example shows us that discipline, not luck, makes the difference. And then there's Nelson Mandela. Even after years of confinement weakened his circulation, he remained active through small, consistent movements and simple routines. He showed the world that resilience isn't about being free of health challenges, it's about meeting them with persistence. Swelling is a messenger. It's your body's way of saying something needs your attention. Sometimes it's circulation, sometimes diet, sometimes a medication, and sometimes something more serious. But the point is, you can act. A 5-minute routine, a little less salt, a bit more water, and consistent movement that's not much to ask for the chance to feel lighter on your feet and freer in your daily life. So here's my challenge to you. Starting tonight, don't just slip your shoes off and sigh at your swollen feet. Do one thing, just one, to give them relief. Elevate them while you read. Take a short walk after dinner. Swap the salt shaker for a squeeze of lemon. Because swollen feet may be common, but they don't have to be your normal. Your body is waiting for you to listen, and your best years are waiting for you to step into them. If this video gave you even one helpful idea, please tap the like button, share it with someone you care about, and don't forget to subscribe to Senior Health After 50. Together, we can make healthy aging a reality for more people.